Thank you so much for having me. As Sean alluded to, I am a native Tar Heel. I grew up in Raleigh, and so this morning when I went to the breakfast buffet and they had grits, I knew I was home. I was so happy. So I guess first of all, I'll show you my my obligatory disclosure slide. I don't make any money from anybody other than the University of Virginia. And my goals today are really simply to start a discussion, start a conversation about IPE, think about it here at Forsyth Tech, to consider some of the factors that can affect the success of an interprofessional education program. And I'll tell you lots and lots of embarrassing stories about myself and our group as we've traveled through. Can you hear me? No? Oh, I'm so bad at this. Okay. And so I'll share some of our experiences, the good, the bad, and the ugly, to kind of give you a sense of what is involved in starting IPE and moving through that. So I first got interested in interprofessional education in the late 80s, early 90s. And at that time, I was actually in pharmacy school at the University of North Carolina. And my brother was in medical school across the street from me. And at that time, we were both taking a pharmacology class. We were both taking pharmacology from the same professors. And we had absolutely no interaction with each other at all. And if we hadn't been having discussions around the family dinner table, we would have had no idea. And he would have had no idea what I was learning that was different and complementary to what he was doing. And he would have had no idea what I was going to be bringing to that team that he one day was going to be a part of. And so ever since then, I've been thinking about interprofessional education. I've been thinking about healthcare teams. And I've been thinking about the fact that we educate ourselves, in silos, and then we throw people out into teams and expect them to know what to do. And that's really not fair. So why IPE? I'm not going to harp on this. I think that this is pretty well established at this point. So first of all the accrediting boards require that we do IPE now. I went through, for some of the groups that I'm a little less familiar with, dental hygiene, dental assisting, radiology technology, I actually went through and looked at all of your accreditation standards, and I'm not going to say that I remember much of them, but I did see interprofessional education in all of them, or at least something about collaborative practice, something about knowing how to work with others when the students leave our schools. But more importantly than just the accreditation standards, which I can say because I'm not responsible for the accreditation of my school. I'm sure other people would not feel that way. But more important in my mind is the value that it provides to the patients. The evidence is overwhelming at this point that healthcare teams that are functional provide better quality care. And the way that we do that is through enhancing communication across and between team members. So if this is so, I keep hitting the wrong button. So if this is so compelling, why isn't it everywhere? Why aren't we all doing it all the time already? And the first and one of the biggest reasons is time. So I think Tammy and Sean heard me talk about this at, we say that the top 5 problems with IPE are scheduling, and scheduling. Because everyone's got their own curriculum, And everyone has had that curriculum for some time. That curriculum has evolved because it has worked within those groups. And changing them is not an easy task. And so this whole scheduling component is a real significant issue. The other thing, thinking about time, is that when you bring these groups of students together who aren't accustomed to working with each other, anything that might have taken an hour for an individual group now probably takes 2, because you got to get everybody to the room, and then you've got to have an icebreaker, and you're going to have a debrief at the end, and then you're going to have a reflection. And so if you don't schedule an extra hour, then you have about a minute and a half for the actual content once you do all those other things. Am I doing okay with the microphone? Yeah, in the back? Okay, good. So time is a real concern. Change. So I already alluded to this. Change is hard. And, all you have to do is look at my multiple attempts at dieting in my life to know how hard it is, right? Like, I know how to eat right and I know how to exercise, but it requires a change in my routines. And change is hard. And the reason that we get in the routines that we have is because they've worked for us, right? At some point, the routines that we developed served a purpose. They got us where we needed to go. And so there's also, comfort in that. And so venturing out into the unknown becomes, daunting at times. Then there's the component of effort. So no one teaching at the collegiate level is lazy. I think we all know how hard we work. And I think we also know that most of us are overcommitted already. It's the rare day that I leave my office and go home that I'm not taking something with me in my briefcase that I'm intending to work on that night. There are occasional weekends that I find myself in my office because there's always more to be done. And so asking someone to add something on top of their already, copious workload, again, presents a challenge. There's also the issue of a lack of shared vision. And, I can't tell you how many times. So we've been running this interprofessional train-the-trainer team training program at UVA for 5 or 6 years now, and we do it twice a year. And we have these groups who are already incredibly invested in IPE, who are coming to kind of concentrate on their projects and move them along. And we sit them down, and this was not this group, okay? And we get them started working, and about, a half an hour in, they start realizing that they all thought they were talking about the same project, but they all have very different ideas of what that project is, or what the goals of the project are, or how it's going to happen, or who's going to be involved. And so, getting everyone on the same page at the beginning is very important. And then finally, there are issues that arise within teams. And this is where we're going to be spending a lot of our time today. So first of all, if you Google pictures about headbutting, you get some very, very interesting things. And some of them were actually quite disturbing. But I do like this one because not only, is there kind of this power struggle going on, but it's a power struggle that's going on between, 2 individuals who potentially look like they could be at the same kind of level, right? So it's not so much a hierarchy thing necessarily, or maybe they're battling for hierarchy. But I also like that, they've got an audience, right? Because I don't know how many of you have been on a team where there's been a conflict between some members of the team, and instead of, trying to help placate that conflict or resolve the conflict in a constructive way, you get people who are kind of off on the sides betting on who's going to win, right? And, I'd like to say that I haven't been one of those people on the sidelines, but I have, right? And sometimes I've been cheering pretty hard for one of the parties, and that probably served no one. So you guys are going to hear a lot of humbling stories about me today. All right. But so when we talk about IPE and we talk about collaborative practice, at the heart of what we are discussing is teamwork. And most of you have probably seen or heard, the pit crew being held up as the epitome of teamwork, right? So the dude over here who's taken off the lug nuts knows where, he's got his gadget, and then the other guy's got the tire, and they've got this down to a science. And when I was working in the pediatric ICU, I was part of the trauma response team. When I went downstairs, my job was vascular access left. So I was supposed to go to the left side of the body of whoever I was going to respond to, and I was going to find an IV. And that was my only job. And there was somebody else who had the airway. There was somebody else who was doing chest compressions if they needed them. There was somebody else who was on the right side looking for vascular access. And we knew our roles. And that was one of the most functional teams I've ever been a part of. And one of the reasons is because one of my good friends used to always say, we're at our best when things are at their worst. So when the chips are down and we've got to do something, we can make it happen. And all of the petty squabbles fall away, people get focused, and we work together. But as soon as the crisis is over, things start to devolve again. And so what I have found is while we aspire to teams like this, most of the teams that I've worked with have looked more like this. All right? So you know that these guys are on the same team because they're all wearing the same t-shirt, right? You guys have to laugh a little, okay? This is going to be a long several hours if we can't have some fun. All right, but so if you look at these guys, or this guy over here, all right, here's the pointer. So I'm not doing it right. So I'm just going to walk over here. So this guy clearly has no clue what's going on, right? The people in charge are focused on something completely different, right? There's this little dude in the back, right? That was always my kid on the soccer field, the one that was picking flowers in the back, right? The pitcher's waiting to pitch, but nobody's ready to receive. The batter is actually in a different direction, right? And the only two that are interacting with each other at all are these guys who are trying to push each other out of the way, right? So revisiting those two rams that we were looking at earlier. And so Jody Hoffer-Gattel is a professor at Brandeis University, and she's come up with a concept that's called relational coordination. And here she talks about how coordination among team members isn't only about the interdependence of the task, but it's also about the interdependence of the people who perform those tasks. Okay? And that's a really important point. That it's not just about what you're trying to achieve, but it's about the people who are involved in making that happen. And so, what she's trying to do is take my little ragtag team and move them into something like this. By establishing, what the clear roles and responsibilities are, and how people work together within those different roles. So when I break all of this down, in my mind, I kind of think of interprofessional teams as being composed, one, of the professionals, right? Thus the interprofessional team, right? So there have to be professionals in the group. And then there have to be teams. But the other thing that I think we don't talk about very much are the individuals. And so we're going to spend a fair amount of our time together thinking about this. So when we talk about the professionals, what we tend to talk about is what people bring to the table, right? So as a physician, I bring, an extensive knowledge of pathophysiology. As a pharmacist, I brought, a lot of background knowledge about different medications, about pharmacotherapeutics. As a professor in the nursing school, I have a whole new perspective now. In fact, I think I'm actually now my own interprofessional team. So, but when we talk about the individuals, we're talking about who you bring to the table. So that's I don't want to put anybody on the spot, although if anyone wants to actually talk to me today, we could certainly have a conversation. Think about why you do what you do. Why nursing? Why MRI tech? Why dental hygiene? Why pharmacy tech? What other groups am I missing in the room? I don't want to be exclusive of anyone. Imaging. Massage. Am I missing anybody? Medical assisting? Cath lab. HIT? Okay. Nuclear medicine. Okay, thank you. I did actually look at your website and read all of these, but I knew I would forget in the moment, so please forgive me. But so why did you choose that profession? What was it for you that resonated? And what is it about teaching? Because you all not only chose your profession, but you chose to teach within that profession. And what is it that you are hoping to accomplish? And I bring this up because the answers to those questions can be very different. They can be very different for people between professions. They can be very different for people within a profession. And so Amy Rusneski is a professor of management at Yale, and she's made an entire career around these questions. And she talks about really kind of three streams of why people choose the professions that they choose. The first is as a job. So these are the people who go to work. They go to work so that they can make money, so that they can support their families, so that they can do the things that they want to do in their personal lives. It is an incredibly valid reason to have a job, right? To support oneself, to support the people that you love, to do some work that's meaningful, but to, create a space where you can do what you want to do with your life. There's another valid reason, which is a career. She talks about a career as going into a job because you are looking to learn valuable knowledge and skills that will then help you move to whatever the next thing you want to do is. Okay? So I'll confess, I went to high school because I wanted to go to college, right? That was not my end game. It was a step in the way, right? And so for some people, their current position is part of a career path. So for some, there are jobs. For some, there are career paths. And then the third category are people who feel their work is a calling. And I think when we are in healthcare, we have an overrepresentation of people who feel like their work is a calling. These are the people, so is there anyone in this room who knew that they were going to do what they are doing now before the age of 10? Right? That's probably a calling, right? There's something that resonated with you. There was something that was compelling. There is something that has a different kind of meaning. And again, I want to emphasize that all three of these are perfectly valid reasons. But depending on what your perspective is on your particular position at this particular time in your life, you're going to be bringing kind of a different self into the group. Does that make sense? A little bit? So I want to get you guys involved now. So you all have a handout in front of you that says identity circle. So let me tell you a little bit about this exercise before you start. So the main question is, how do you identify? So this is about how you see yourself. And I have to tell you that the first time I experienced this exercise, it caused me a little bit of an existential crisis. Because I was like, oh my God, I don't know. Who am I? Right? And I started freaking out. I'm not trying to do that to anybody today. All right? But so to give you an example, right now, I see myself as kind of a lot of things. So despite the fact that my clinical practice is fairly limited, I still identify in this top right corner a big chunk of myself as a pediatrician, right? I spent 18 years dedicated to nothing but the care of children. And so even though I'm not doing it as much anymore, it is still a big part of my identity. Down here below it is my teacher wedge. So the more that I'm doing classroom instruction, the more that I am doing workshops like this, the more that wedge has actually expanded over the past couple years. And then over here on the other side, I have things like I'm a mother. I'm a mother of 3 children. I am a spouse, and I try to deal with the fact that that's a really small wedge now. That one used to be a lot bigger. I'm an aspiring researcher. I am a daughter, which is becoming more important as my parents are aging. Because if you had asked me 10 years ago, despite the fact that I was a daughter, that wedge probably wouldn't have shown up, right? But now I'm thinking about making it safe for my parents to age in place, and this is kind of an ongoing thing. And then this orange wedge over here, which should really be the red one, I am a rabid hockey fan. Go Canes. Any hockey fan? So, there's got to be at least one. Thank you. All right. This is going to come up again later in the talk, so I appreciate you being here. Tell me your name. Tracy. And you are also Dave? Okay. I promise I won't pick on you too much. Okay. All right. But so what I want you to do is you've got a little area where you can make a list, and you can think about the things that you identify as. What are the things that kind of pop to your mind? Again, no one's going to hold you to these if you come up with something later that you're like, oh, I should have put that in there. Okay? And take a few minutes and create your identity circle.
Test, test. Is this better or no? Yes? Okay. We'll try again. We'll try. Keyword is on.
All right. So maybe just another minute or two. Looks like about half of you are done and half of you are still working. So I'm interested to hear a little bit about your identity circles. Is there anyone who's willing to talk about what they saw, what they found, what they wrote down? Maybe if there was something that surprised them? Thanks. It was all pretty well equal.
So out of the 10 what do you call them, identifiers? They were all, that's my type A as well, but.
And how many of them related to your work?
One, maybe two. Being a nurse and then being, the teacher, academics.
Anybody else? It only takes one or two brave souls to start this conversation. It'll make it a lot more fun as we go. Thank you.
I have 9 identifiers, and I'm not surprised that mom, student, and dog person take up the biggest part.
Mom, student, and dog person. Awesome. Oh, thanks, Sean.
So I have 11, and the ones that pertain to things that are for me, like things that I like or my interests, are the ones that I was very reluctant to give myself very much of, despite how much I'd like to give them. It's teeny tiny little slivers.
Thank you.
45% of mine was work because it takes a chunk of time. 20% family, because I'm a mother, grandmother, sister, all kinds of stuff like that, wife. My friends outside of work were really not getting much of me at all. because there's not a whole lot of time to see people outside of work, although we have friends at work too. My individual needs were kind of like you, 5%. And, you know, my family was up there with the job, about 25%.
I think I've recently recently I have retired and went into clinical instructor, so I'm actually rearranging my priorities now. So I was surprised to see, because the first thing I wanted to put was work, and you know, that's not my top thing right now because I'm trying to reorganize how to do my life. So I think I was just surprised at how to rate them in priorities.
So thank you guys for being willing to contribute. So if I were to ask, so I heard 20% work, I heard a slightly bigger chunk work, I heard 45. Mine, if you look up there, is a full 50%, right? And if you think about it, if we sleep 8 hours, we work 8 hours, then half of our working, half of our day is spent at work. So it's not surprising that that could be a big chunk. Was there anyone that had work as more than 50%? You guys are awesome. Okay. Yes. Right. But, and yes, that's absolutely the case, and that's what I was going for. But there are a number of groups that I have done this exercise with the same instructions, and nothing different about how we entered into it, who have 80% of their circle related to their profession, because that's how they identify. And the other way that I could ask this question is, how long does it take when you first meet somebody that you tell them what you do? Well, okay, I'm hearing murmurs. So it's no. So it's not as big a thing for you. That's wonderful. It's totally situational. Okay. Yeah, because even my kids, when they introduce me, they're like, "Hi, this is my mom. She's a doctor." Right? So I guess there I get mom and doctor in, equal slices. But it's not like, "This is my mom. She plays roller derby." Right? That'd be a cool thing for them to say about me. Was not what they pick. It's also because I'm really bad at roller derby. But I am trying. All right, but so the reason that I bring this up and the reason that I do this exercise is because as we come together in teams or even in groups, this is an opportunity for us to find ways to connect with each other. And a lot of the ways that we connect or don't relate to these kinds of things. And so I want to tell you a story about a colleague of mine who was doing some organizational work with a team that was really struggling. And when I say that they were really struggling, they were more or less at each other's throats. They were doing things like keeping notebooks of all of the things that their colleagues were doing wrong. Okay? This was the level of dysfunction in this team. And they were instructing their students to keep notes about the things that their colleagues were doing, how they perceived to be wrong. So my colleague was called in and was working with this group, and he did a slightly different exercise with them, but that one, he was doing an icebreaker, tell, who you are, what you do, something no one knows about you, kind of the standard icebreaker. And the two of the people who were most at loggerheads found out that they were both church organists. And all of a sudden, they had something in common. And all of a sudden, they could come together on Monday and talk about what they'd played in the service the day before. And all of a sudden, they had a basis on which to create a different relationship. And it's because we have all of these different facets to ourselves that sometimes we clash, and sometimes we can actually find connections where we've struggled in the past. And if you think about the teams that we work in, you know, there are going to be some people with whom you have lots and lots of overlap, right? I have one colleague who is the same kind of pediatrician that I am, who has kids that are the same age as mine, who also is from North Carolina. So we have lots and lots of overlaps. And then there are some of the other people with whom I work who I have very little in common with. And so then there also becomes the concern of, do you start connecting so much with some people that you exclude others? And not because it's intentional, but because that's just who we are, right? We like to be around people that we have things to talk about with. And we talk about things that we have in common. All right, so I want to do one more activity. And I'm going to pass out these papers, but I don't want you to look at them until I tell you to. Thank you, Sean. Thanks, Tammy. So once you guys all get your sheets, and again, please keep them face down until I tell you not to, I'm going to read you a story. And I'll actually read you the story twice. And then I'll have you flip the page over and answer some questions about the story. All right, everybody got one? All right, I'm going to read you the story now. Everybody ready? All right. The supervisor yelled at the new recruit. The young man waited until the supervisor was gone and poured sand into the machine, smiling at his sister who worked there. Later that month, the boss discovered the problem and fired him. The woman felt bad and quit in protest. Okay, I'm going to read it one more time. The supervisor yelled at the new recruit. The young man waited until the supervisor was gone and poured sand into the machine, smiling at his sister who worked there. Later that month, the boss discovered the problem and fired him. The woman felt bad and quit in protest. So I'm going to give you about 2.5, 3 minutes to answer those questions. Go. So what I want you to do now is to organize yourself in some small groups, so just however you can kind of come together fairly easily. We're going to give you an extra sheet for you to use amongst your group, and I want you to come up with one set of answers for all of you in your group. All right, can I get everybody's attention back, please? I know that you may not have finished. That's okay. All right, so usually when we get in groups like this, there's at least one extrovert in each crowd. If that didn't work out, sorry. But what I'd like to do is kind of get a straw poll of what you guys were thinking. So, question number 1. After being yelled at, the young man poured something into the machine. Who said true? Well, okay, so for the groups. All right, so we have one. All right, so can I get one spokesperson from each group to like stand up and identify themselves? Thank you. All right, we're making progress here. No, wait. Okay, stay standing. Stay standing. Okay. So, I think what I'll do is I'll just kind of go around. So, question 1, group in the back. True, false, unknown. Unknown. True. False. Unknown. True. Unknown. In the back? Unknown? You're with the group over there. Okay. All right. So not full consensus. All right. Some of each, actually. Okay. The young man's sister worked there. I'll start over here. True. Unknown. Unknown. True. 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 Okay. 2 men are involved in this story. We'll start back over here again. Unknown? Unknown. Unknown? All right, so we got better agreement with this one. Okay. If the Superman Superman, that was fun. All right, if the supervisor had not yelled at the young man, he might not have ruined the machine. Anybody got true? True with a question mark, okay. Anybody got false? Unknown? Okay. Where am I? It took the supervisor a month to realize that the new recruit had ruined the machine. True? False? Oh, we had a true? Okay. False? All right. Unknown? Okay. I think probably you have the point, right? So, all of you guys heard the exact same story. In fact, you all heard the exact same story twice, right? But even amongst our groups, we had some dissension. And so tell me about your experience of within your small groups. Did everybody think the same things? No. Nobody heard the same thing.
I heard things that the group didn't hear. Like, what was it I was saying? I forget. New recruit and young man are 2 different people. And he was yelling at the new recruit, who was a different person than the young man, and the young man was the observer who was pouring sand in the machine. But nobody else heard that.
What else?
They could have been the same.
Okay. Well, so let me ask this question. So when you got started working in your small group, so is it fair to say that in each group there were people who had different answers from each other? Okay. So when you started doing your work, how did you start doing it? I'm going to put you guys on the spot. Sorry. Well, no, I'm not going to put you on the spot. I'm going to go put somebody in the back on the spot. All right. Sorry. You're the one. So when you guys started working together in your group, how did you do that? What did you do?
We said number 1 and read off the statement, and then what did you get, what did you get, what did you get, and then we tried to, people would throw out their ideas on why they chose a certain answer. We had a lot of aha moments like, well, that makes me think about that. Well, oh, I didn't consider that.
Okay, but so you just kind of jumped in, you read something out, you did it kind of the democratic process, and majority won. Okay, but it sounds like when there wasn't a clear consensus that you did actually have some discussion around the topics.
Yeah.
Okay. All right, so there are some times that the answers changed after the discussion. All right, what about this group? Did anyone handle it differently? Did anyone have a conversation about how you were going to do it? Or did you just jump in? Oh, you did? Oh.
We have all been leads of a course, so we all
You all attack things the same way. No, so a little bird told me that you guys are all nurses too, right? Yeah, so you're all nurses, you all work together, you've all been the leads of the same class, so it makes sense that when you came together, you kind of had the same perspective on at least the process, even if not the answers. It's comfortable. Okay. Within this group, you're comfortable. Now, I hear that there was a group over here and this group down here where you're not all the same profession. So now you guys, sorry, you're back on the spot again. None of you are the same. Okay, so was that different for you then? Did you have a process discussion or did you just jump in the same? They elected you.
She did. She made me do it.
Which she? All right. You're married, right? Oh, see, someone told me already.
How'd you know my name?
All right. So why did you elect your neighbor?
Because we are cousins. Yeah. Yeah. Because I didn't want to do it.
So you didn't want to do it, so you volunteered.
Right.
Okay. All right. So you guys thought you were safe over here, right? All right, so any takeaways from your group? Anything different? Everything exactly the same as what we've heard?
exactly like,
The same way? And what happened when you had a disagreement? Did you talk it out? Okay, what about you guys? Same. All right, okay. So we all heard the same story. We all heard the same story twice. We all heard it a little bit differently. So why do you think that is? All bring our own experiences, our own, I heard, inherent biases. Okay. And it sounds like all of you guys are fairly amicable. When you had a disagreement, you just kind of talked it out. Did anyone start really advocating for their position? Thank you for being honest. I appreciate that. So say something about that. Okay, so you would concede, but you wouldn't go down easily. Okay. All right. Well, so that's, I appreciate your honesty. Thank you for that. Okay. Did anyone just kind of disengage? You did. Okay. Okay, so so they were still actively trying to include you, but you were like, nah, I'm good. Okay. All right. Thank you for being willing. Anybody else have a different take on it? You think these kind of things happen in our groups all the time? Where someone might get a little miffed? Where someone might seem engaged but have already checked out? That maybe one person takes on a dominant role? Were there any people who wanted to be in the dominant role that didn't get the dominant role? Nobody that's going to admit it. Oh, yes, okay. You are vying for the dominant role? You are double teamed. Oh, the dirty little secrets are coming out now. So, all right, I'm not trying to instigate conflict, okay? I just want to put that out there. Okay, but so, all right, let me show you the story. So here is the story. The supervisor yelled at the new recruit. The young man waited until the supervisor was gone and poured sand into the machine, smiling at his sister who worked there. Later that month, the boss discovered the problem and fired him. The woman felt bad and quit in protest. All right. So I already asked this question, but just to get back to the next slide. So what happened? Not in the story, in the teams, in the process. Huh? Say again? What? What are the real answers? See, this always happens in healthcare groups. We have to know the right answer. All right. So I'll show you the right answers in just a second. But we've already identified that we were all making assumptions, right? Maybe we were making assumptions that the young man and the new recruit were the same person, or maybe we assumed they weren't. How many of you, all right, hold on. I got to get my glasses back on. I guess I could just do the slide. So how many people assumed that yelling conveyed anger? So is it possible that they were working in a factory and the only way they could hear each other was to yell? That pouring sand in the machine was bad? Could it be a glass factory? Could it be a cement factory? Maybe that's what the person was supposed to do. That the new recruit was the young man, that the sister was the young man's sister, because the sister could have actually been the supervisor's sister, but only if you assumed that the supervisor was a man. The problem was the sand in the machine. The young man was fired. So this is a really intentionally ambiguous story. And I love this exercise because it always works, okay? I don't love it because it's kind of a gotcha, right? Like, oh, look, I made you all do exactly what I wanted you to do. But it's the reason that it always works is because we do always make assumptions, right? And so here are the answers. There are only 2 things out of this whole list that we actually know. We know that sand was put in the machine, and we know that somebody was fired. Everything else is ambiguous. And so the point of this is that we go around in our everyday lives filling in the blanks. We are faced with incomplete information, and we have to try to make sense of it. And we do that kind of based on our own personal experiences, our backgrounds, our training, our education. So, like when I look at this picture, since I am a pediatrician and a mom, I see this kid up here and I automatically assume he's in timeout. I'm going to guess that no one else in here went there, right? You probably actually weren't paying that much attention to the picture, but that's okay, right? But so the point is that because of how we have evolved, we are very acutely aware and trained to notice the negative. We are inherently aware of things that threaten us, of things that could hurt us. That's why I put the saber-toothed tiger up there, because back when, our ancestors were cavemen, the ones who automatically assumed it was a tiger rather than a bunny sneaking up behind them were a lot more likely to survive and pass on their genes, right? So over generations and generations and generations, we have become very finely tuned to automatically go to threat, to go to the negative, because those are the things that could potentially hurt us. And we are programmed to survive. And so when we go around the world filling in the blanks, it's no real surprise, I've got my slides out of order. It's no real surprise that we fill them in with a negative valence. When somebody yells, it's because somebody's angry, right? When the guy gets fired, he must have done something that was malicious, right? The sand in the machine. And if you think about our education, we actually reinforce this. We systematically reinforce it. So when I was a resident, I was told, before you lay your head down on a pillow at night, you should always be thinking about what is the worst possible thing that could happen to my patient. Because then if my phone rings, I have a plan, and I know what I'm going to do. I work in MRI a lot now. I always hear about, do you have anything metal on? Don't take that oxygen tank near that, right? The reason that we do these are very, very good reasons, right? Because we don't want our patients to die. We don't want the oxygen tank to go flying into the MRI scanner. We don't want to make a med error, right? We have very good reasons for being so acutely aware of everything that can go wrong. And when things go wrong, when we x-ray the wrong limb, or heaven forbid, operate on the wrong limb, we spend tremendous amounts of time dissecting those errors, right? But when things go right, we just keep moving. Chances are we don't even notice. So if you think about how many doses of medications are given at Baptist Hospital in one day, and how many of them are correct? Has that ever entered any of your minds? Only, I'm going to say probably only in the context of when one of them doesn't, right? And so we do this for very good reasons. We do it to keep our patients safe. But what happens is we go around the world with this very negative lens, in part because that's how we're programmed, and in part because that's how we educate ourselves. And so when we go around with this negative valence, it doesn't take long before this starts to creep into our everyday. How many of you guys have heard of the fundamental attribution error? All right, so I just realized that I should have signed into this before we started. Give me just a minute. So this is an award-winning video, Oscar-worthy, that you're about to watch. You'll appreciate it in just a second. Okay, so obviously this is me on the left with longer hair. And this is my colleague, Tina.
Hey, Julie.
All right.
Hey. Oh, Tina, I gotta tell you, I'm about to meet with Karen about all these great ideas that we had at the T3 FDP meeting. I'm so excited about getting the IPE stuff started here. It's way past due. And I'm so excited. When I called Karen, she was, ready to meet with me right away. It was fantastic. And, since she does all the gerontology stuff, it's really important we get her on board.
Oh, I'm so excited that Karen's going to be working with you. She's amazing. She's really, really engaged in all of this, and she's so dependable. I know you're going to have a great time working together. Oh, hey, I got to go.
All right.
Good luck with the meeting.
Great, thanks. I'll see you later. I'll come tell you about it.
Okay.
Okay, so, all right. Our meeting was at 2. It's 2 to 5. I guess maybe she just got held up. Maybe I'm in the wrong place. Maybe this isn't where we're supposed to meet. Check my calendar. No, this is it. Yep, 2 o'clock. 2:15 now. Okay, well, this is just rude. I mean, Tina said that Karen is so dependable, but she's certainly not dependable today. Maybe if Tina had called her, she would have shown up. Clearly, she has absolutely no respect for me and my time. Okay, so what's the rule? The rule is what, 30 minutes for a full professor? Clearly, she's not showing up. I've waited half an hour. Okay, you know what? I'm busy too. I'm not going to keep sitting here just waiting for her to show up. Hey, Julie! You know what? We don't even need you. Just forget it.
So what just happened? Miscommunication, all right? Say more. You hope that's what it was. So miscommunication, but what just happened? An assumption? No opportunity to explain? Or if she was late? She looked like she thought she was on time. Thoughts from up there? What happened in this video? This is going to be a long workshop. Thank you. Huh? Assumptions were made. Okay. So if somebody had actually made an effort to communicate, maybe the conflict could have been avoided. What else? All right, so something that I had been excited about was ruined in an instant. The collaboration just tanked right there. Yeah. Negative self-talk. Yes. Uh-huh. Okay. So we go down a certain road, and it doesn't mean that road, we create a story, and we don't really know whether that story is the right way, but that's the way that we go. And if I talk about the negativity bias, it makes sense that maybe the story that we pitch ourselves might not be the right, the best one. Okay, where did I put my clicker? Sorry. This is what happens when I wander around. Okay, well, so first of all, let me tell you about the fundamental attribution error. So the fundamental attribution error means that when something happens and someone else does it, then we blame the person. So Karen was late, and I blamed Karen. She's not responsible. She doesn't care about me. She's being rude, right? So we blame the person when it happens with somebody else. When I'm late, it's, oh, well, I was coming down the hall and I saw somebody and I had to stop and talk to them. Or my watch was wrong. Or when I'm walking along this stage and I trip, right? It's not because I'm clumsy. It's because who put that there in the first place, right? Like it's a circumstance. When we do something, it's a result of the circumstances around us. When someone else does something, it's because of who they are. Okay? So that is the fundamental attribution error. And this kind of thing happens all the time. And so this was kind of a campy and ridiculous video. But Tina, my friend in the video, there's a time she and I were working on this project, and we were trying to get the surgeon that she had worked with to come and be part of the project with us. And so she sent him an email, and he didn't respond. So she was like, okay, he's really busy, right? He's really busy, so attributing it to him. I'll send him another email. So she sends him another email. She doesn't hear back from him. So, okay, so now he's blowing me off. So I'm going to send him one more. We've known each other for years. He's always responded to me in the past. I don't know what's going on. Maybe he's getting a big head. Now he's the chairman of the department, right? And so she sends him one more email. He still doesn't respond. So now she's mad. And she's coming to me and she's like, well, he's clearly not interested. We have to find somebody else to work with. I can't believe, right? Like all the things that just happened on this video. This is real life, okay? Come to find out, Reed actually was critically ill in the MICU at the time that we were sending him these emails, and she didn't know. So chances are, had he actually gotten them, he would have responded. But we went down a very, very different pathway. And so these things actually happen all the time. And so when I ask you about what happened in that video, I got lots of great answers about assumptions. So it may have been that I was early. Maybe Karen wasn't late. Maybe I had the time wrong, right? But what I wanted to really hear is what happened is that I showed up and I was waiting for Karen and Karen didn't come, right? Like that's actually what happened. But we already are down this path. And so I'm sorry this doesn't project as well as I would like. But this is something called the ladder of inference. And so when we start out, there is observable data and experiences. So I showed up. I thought I was meeting with Karen. Karen didn't show up. I got mad. I left when Karen was getting there. All right? And so I select the data about what I observe from that. So I observe that I'm there, she's not. I add meaning to that. I was there on time and she was late. Okay? And then I make assumptions. Well, she was late because she didn't care about our meeting. And then I draw conclusions. Karen is going to be a pain to work with. I don't want to work with her. So now I have a belief. And when Sean comes up to me and says, hey, I'm going to work with Karen. Oh, no, you don't want to work with Karen. Right? And now I am taking actions based on my belief. Because now I believe that Karen is not going to be a helpful ally, and so I'm not even going to try. Oh, and I'm going to badmouth her to other people too. Right? So you can see how this went from I showed up and she wasn't there yet, to Karen is a terrible person. Right? You can see how that happened, right? It tracked right up that ladder. And this is something that happens all the time as well, right? When someone pulls in front of me in traffic, it's not because, oh, they must be in a terrible hurry because their grandfather's in the emergency room with a heart attack, right? It's because that's a selfish person who wasn't paying attention, is pulling in front of me because they think they're more important than I am, right? So I could go on for days about the stories that I can create, and none of them are particularly flattering, and that probably says more about me than the people I'm making up the stories about. All right? So to avoid climbing the ladder, as I call it, well, I don't call it, Peter Senge calls it that, and I take credit for it apparently. I'm really not trying to take credit for his work, okay? But so you can ask, okay, what really happened? I showed up, Karen wasn't there. Oops, I went the wrong way. What was said? What did I hear? We already had that kind of conversation around the sand in the machine. What conclusions did I come to? Could there be another explanation? Could it be that I had the time wrong? Could it be that Karen was on her way and something, a student stopped her in the hall and was very upset and she had to stop and talk to that student, right? And my personal favorite is, why would an otherwise normal, rational person act this way, right? Because there oftentimes are other reasons, but we actually have to stop and consider what those might be. And so that leads us to a concept called the confirmation bias. And this is the idea that people always find what they're expecting to find if they allow their expectations to guide their search. So if I go home and I think, my kids are lazy and they don't care about my house, and I walk in and there are dishes on the counter, I have just confirmed my assumption about my children, right? No, it doesn't even matter if the dishes on the kitchen counter are the ones that I left there that morning, right? Because clearly my kids should have seen them and cleaned them up, right? It wasn't that I'm the slob, right? And so as we go around and we're looking for things, we are likely to find them. So if I believe that Karen is disrespectful, then I'm going to watch everything Karen does and find the one thing that she does that validates my point of view. Okay? So the next thing that I want to talk about is what you pay attention to. And so we talked about the fact that when we go around the world, we have incomplete information, and we have to start filling in the blanks to make things make sense to us. And so the flip side of that is that we are bombarded with information all the time. So I'm going to guess that most of you did not know that there are 8 posters on this wall and that there's 6 on this wall, right? Because you might have noticed that they were there, right? But the number of posters on the wall is not a relevant point to you right now. There are other things going on that take precedent over the posters on the wall. And so they become triaged data. When I was driving over from the hotel this morning, I drove past the Haynes Mall and I drove down Silas Creek Parkway and I, came in, and I guarantee you that there were some cool things to look at, right? Like I could have figured out what stores were in the mall, I could have seen what restaurants I drove by, but none of that registered for me. Because what I was paying attention to is the car in front of me, and whether or not their brake lights were coming on, because if their brake lights were coming on, that meant they were going to slow down and I needed to slow down, right? And so there was all of this information. Maybe I was hopefully I was paying attention to the stoplights as well, right? But there's all of this other information going on around us, but you focus in on what is important and relevant to you, right? And so this also happens in kind of our professional realms. And so it's no surprise that when we all look at the same patients or the same students when we're educators and see them from our perspective, right? And so we can all be looking at exactly the same thing and come away with very different conclusions. And so the question then becomes, do you ever wonder what you're not seeing? And I will propose to you that the answer is not very often. And the reason is because we are highly attuned and we know what we need to look at. So when, I was, let's see, what story do I want? When I was working in the ICU and I came in and I walked over to the patient and it was a child who had had heart surgery the night before, I could walk up, I could look at the monitor, I could feel the patient's feet, I could see what the urine output was, and with those pieces of data, I could tell you whether the child's heart was doing well or not. And it's only when things are not the way that you want that you start looking outside, right? So I was, again, in MRI the other day, and we put the kid on the MRI table, and we got everything done, and then they went to, push the table in, and the table wouldn't go in. And so then we had to stop and troubleshoot it. But it wasn't until there was a problem that we went and started to look around. And so the majority of the time, we don't think about what we're not considering. And when we do stop and think about what we're not considering, who do you think we talk to about it? The people closest. So the people who tend to see things the same way we do, right? So I was going to say, so when I was in the ICU and I was working as the physician there, and I had an argument because I saw the patient one way and the cardiologist saw the patient the other way, who did I go to? The other ICU doctors, right? Why? Because they were going to see it my way. And this is, again, human nature, right? Because we much more want to hear that we're right than any other answer. And so all of these things that I've been talking about are individual characteristics. These are things about who we bring to the table. They're the things that we've learned, they're the ways that we've been trained, and we don't even realize that they're a part of us until we hit up against something. And I was actually going to tell you a story about when I was recently on a vacation, and I actually did what this bird did and walked straight into a plate glass window. And my initial reaction was to get mad at my husband because that door had been open a minute ago, right? It had nothing to do with the fact that I actually had gone to the pane of glass next to where the door had been. So it wasn't his fault, it was my fault, right? But you go down these pathways. But what I'm bringing this up about is that we often talk about conflicts among teams as being the elephant in the room, right? Like we somehow know what the conflict is, and we're just ignoring it. And those certainly exist, right? We all have been on teams, again, where we have known that there has been an issue. There has been an issue of hierarchy, or there's been an issue of a dominant personality, or there's been an issue of one person always having to bend over to accommodate the rest of the group, and they just don't get talked about, and there's kind of seething and underlying resentment and those kinds of things. But what I'm trying to talk about is the elephants that we're not even aware of, right? So these are the things that have, over time, just become a part of the fabric of who we are. My mom was a nurse. My dad was a child psychiatrist, which is a whole different story for a whole different day, right? And, so I grew up seeing the world, from this kind of service perspective, and that's how I think people should behave. And when people don't behave, I don't get it, right? And it's not because anything's wrong with them, but it's because this is who I have become over time. And all of us have these elephants and giraffes and zebras and all kinds of other things that are part of our fabric that we walk around with every day that we don't even recognize as being there. Does that make sense? And these things come into the way that we interact with each other because of who we are, not even because of our profession. And so I love this little girl. This just makes, I shouldn't be happy at a really angry little toddler, but that makes me happy every time I see it. All right. So the other question then becomes, have you ever been in a situation where something relatively minor happens and it evokes emotion way out of proportion? Looks like most of you might have experienced this at some point in your life. All right, so I have, let's see. I'm going to skip this little video since everyone seems to have a sense of what I'm talking about. So no, I'll play it. Have you guys seen the movie Inside Out? Everybody know? So the premise is that the main character is this little girl named Riley, and her family moves, and what you are seeing is there are these little emotions that live inside her head and take over the control panel. So there's anger and joy and sadness and all these things. And before Riley moved, she was on a hockey team, and now she's moved and she's trying out for the hockey team at her new home. See, I told you hockey was going to come back up.
It's like we don't learn anything. Let's pick it up out there! That's it! No, Frank, find your happy place. Riley, what's wrong? Let's go. You're not going to finish tryouts? What's the point? Hey, it'll be all right. Let's just stop saying everything will be all right. Nice hustle, ladies.
All right, so Riley's reaction there had absolutely nothing to do with the fact that she tripped and fell on the ice, right? She had probably tripped and fallen on the ice 1,000,000 times. I trip and fall on the ice every time I go on the ice, personally. All right, but her reaction had to do with the fact that she wasn't adjusting well. She had just been rooted out of where she was at home and where she was comfortable, and then her family moved, and now, any little thing that went wrong was an issue. So it had nothing to do with the issue at hand. So that's one reason people can react. So a friend of mine, I remember, I I would go up and talk to her. She'd kind of blow me off. She'd be kind of brusque. She wouldn't have much to say. I went up to talk to her the next day, and she kind of blew me off. And I was starting to, go down. I was climbing a ladder, right? Like I was building a story, and it was not going to end well. And then I found out the next week that her husband had just left her, right? It had nothing to do with me. And so those things can happen. But the other thing that can happen, and this goes back to the fabric of who we are, is there are things that we have that are very deeply held beliefs. So maybe they come from your religion, maybe they come from your family of origin, maybe they just come from your worldview, maybe they come from your education. This is what it means to be a massage therapist, right? And when people hit up against, we call those icebergs, because they're so much more below the surface, right? And when people hit up against your icebergs, that evokes emotion. Or when you hit up against someone else's. So I'm going to tell you another story. So and I'm sorry I keep going back to these ICU stories, but these are what I have to tell you because they're my experience. So I was working in the ICU, and one of the worst parts of my job was what we called hotel management. So we would get in the morning, we had an idea of what children were going to have an operation and that were expecting to come in and have a bed in our ICU. We had, at that point, I guess, a 14-bed ICU. And I walked in one morning, and there was one patient who was ready to go out. There was another patient who was supposed to have a surgery and come in. And I thought, phew, all right, we got everything. It's going to be good. I don't have to tell anybody that they have to cancel their surgery because that's miserable and everyone gets mad at me. And we can take care of the patients the way they need to be taken care of. And today's going to be a good day. And about 10 minutes later, the cardiologist walks in and she says, so there's that kid over in the NICU who needs a heart operation. We're going to do that today. What? So that just threw everything off. And our reservation book actually had notations. So I knew when it was that other child that was supposed to be having a surgery today, they reserved that bed 6 months ago. And I knew that they were from far southwest Virginia, which meant that their family was coming from 6 hours away with the expectation that their child was going to have surgery that day. And I also knew that in our hospital, cardiovascular surgeries tend to trump almost everything else. There's probably a good reason for that, right? But at the same time, I was like, so they just decided on a whim, they're going to do this surgery today, and now everything, like this other surgeon's schedule is going to be affected, this family who's traveled from far away, and I realize that this is probably an assumption, but it tends to be the case. People in far southwest Virginia tend to be fairly impoverished. It was probably a big deal for them to get up there. They probably had people covering their jobs, and all of this was just going to get tossed out the window because today the cardiovascular surgeon wanted to do this operation. And I also knew, because I knew about this child, that this was an operation, like it needed to happen, but if it had been inconvenient for that surgeon, he could have done it tomorrow. The child was okay in the NICU, right? So, this unsuspecting cardiologist walks in and tells me, okay, so today we're going to do this surgery. And I have to say, this was probably the low point of my professional career. I went full out anger, blow my top. I screamed in the middle of the ICU. Maybe this is why I left the ICU. Okay? And I was like, this is not fair. This is not the right thing to do. I got all up in it. I was so mad. I was like, we're not doing this. And the cardiologist was like, oh, yes, we are, right? And so now we're having a showdown at the OK Corral right in the middle of the ICU, right? Right now, all of you are thinking, thank God I don't work with this woman, right? Okay, but so I, my emotion was out of proportion. And so I finally kind of got hold of myself, and I said, all right, maybe there's something I'm not seeing, right? Remember that picture? All right, maybe I'm laser focused, and maybe I need to have a broader view. I thought that this showed tremendous maturity on my part. And so who did I call? I called my ICU friend, and I said, so Janine, ICU doctor, what do you think? And she said, well, you know, Julie, actually, that's a pretty important surgery. And this kid, yeah, it's tough, but this is elective. And, you know, maybe we can get it on the schedule for tomorrow. And I was like, ugh, right? Like, I hate it when they're right and I'm wrong, and this is terrible. But then I had to stop. So everything got sorted out. All the kids got their surgeries. The world was fine. But then I had to stop, and I had to go back, and I had to take account. Why did I react that way? And the reason that I reacted that way is because I actually came from a family where we have people whose lives would be, you know, like if that happened to them, it would be a really big deal. People who in my family would have to travel a really long way to get to a hospital, and they would have had to have rearranged their lives. And I had a lot of empathy for that family. And because one of the things that my parents have taught me since I was crawling on the ground was that fairness is important, and that all people should be treated similarly. And that, you know, and so entitlement, man, that is a hot button for me, right? When someone comes in and say they deserve something just because they deserve it, oh, you're all warned now, okay? So that all of a sudden made sense to me, right? Like the reason I got mad really didn't have to do with the fact that these surgeries were going to get switched around. I got mad because I felt like it was not fair. It was not fair to that family, and that was a family who didn't have anyone standing up for them, right? So then I said, okay, deeply held belief, is this relevant in this situation? Yeah, it really is relevant in this situation. And yes, I really should be championing them, right? Is it the right thing? Or, you know, like, are there other factors that go in? Yeah, actually there are. This kid has a critical heart lesion. This kid is getting a G-tube replaced. One probably takes precedent over the other. And so, you know, it's one of those things where when you hit up against an iceberg, you have to start thinking, is this iceberg still meaningful? Yes. I still, with every fiber of my being, believe in fairness and justice, and that people who don't have others standing up for them need someone to do that if they can't do it on their own. Is it accurate in the given situation? Maybe not. Maybe not this time. Was it overly rigid? Maybe, right? Is it still useful? Absolutely. I will not change the way I believe, right? But so do you see how this can play in? And can you see how, you know, when you're being challenged in this way, it can really lead to challenges within a group? I mean, I had to go back and apologize to that cardiologist. And let me tell you, I was not happy about that. Not even a little bit. Right? But that was who I brought to the table. And the thing is that when you come to the table, you are bringing meaning, relationships, perspective, assumptions, biases, distractors, obligations, desires, past experiences, emotions, and so is everybody else. So that's why the individual in the team is important. And so just real quickly, I do want to offer some opportunity or some things that can help with that. Like, how can you recognize and disarm some of these automatic tendencies? And so one is simply to stop, right? To stop, to take a breath, to observe, what am I feeling? In this case of this last story, why am I angry? What are my choices? What are my goals? And then proceed. This takes a lot of self-awareness. And I cannot tell you that I reliably do this, even now when I teach this stuff, right? But that's the ideal. The other thing is inquiry. So one of my colleagues and mentors, Peggy Pluzogan, she used to always tell me, when in doubt, ask a question, right? So that gets back to climbing the ladder. That goes back to my experience with Karen. So Karen, I noticed that I was here and you didn't get here until half an hour later. Oh, well, this is the time it was on my calendar. I actually thought it was early. Oh, okay. Well, we had different times on our calendars, but we're both here now. Maybe we can work together. Right? When in doubt, ask a question. And then I think perhaps one of the things, oh, this is not what I was expecting. This is what I was expecting, is the assumption of positive intent. And I think this is the most important thing that I have learned since I've been doing this work. So you guys can read this cartoon. This used to be my favorite cartoon. Like, he looks so busy. I'm quiet. I'll be quiet. I don't want to disturb him. Oh, what a snob. I can't believe she didn't even say good morning. Like, I think this happens to me on a daily basis, right? You know, it's the assumptions. But then someone sent me this one, and it says, this one might be harder to read. It says, whoa, someone locked that poor human in a cage and dropped him in the ocean. Don't worry, little buddy. I'll get you out, right? And, you know, so I think that there's something to this, right? And so, you know, the benefit of assuming positive intent, right? So it encourages you to consider that there might be alternate reasons for why someone's doing something. You know, if I had stopped and thought about that cardiologist and said, you know what, she's coming in here and she's advocating for her patient, right? Like, she really cares about that kid and she wants to get what's done, you know, what needs to be done for that kid done. Well, that's kind of hard to get mad at. I might disagree with her, but at least I understand where she's coming from, and I can't fault her for wanting the right thing for the patient she's taking care of, right? So that promotes curiosity, and it might ask you to, or it might say, well, you know, tell me where you're coming from about this. Let me tell you where I'm coming from. It could create a conversation. It might, like in my case, stimulate some self-reflection. You know, like, oh, okay, why did I do that? And you know what? And even if you're wrong and the person is there to pick a fight with you, it makes your experience of it better, right? Because your response is going to be different, and that's going to diffuse the situation. All right, but you may not want to leave the cave and swim out with the shark. You know, you still got to protect yourself a little bit. All right, so individuals in IPE, everyone's coming to the team with their meaning and ambitions and goals and identity. We're faced with incomplete information like the sand in the machine, right? And we have to make assumptions. And they may not be the same assumptions other people are making. We get more information than we can process, and we have to pick what we focus on, and our focus is probably different than the person's next to us. It's really easy to climb a ladder. It's important to recognize when you hit an iceberg or when someone hits one of yours, and take a step back, and then to assume positive intent or lead with the question, and those things can go a long way. All right. So all of that, and I realize that that was a lot of time on the individual, but that's the thing that I don't think that we talk about very much. So now I want to think about it as we come with our professions. So when we come into our teams as a professional. And so All right, here's another self-effacing story that you guys are going to have to listen to. So you did your identity circles, right? And so we have a little bit of insight into ourselves. And so the next story I'm going to talk about was I work now with the pediatric sedation team. And so I was mentioning, I'm sorry, you told me your name? Shannon. I mentioned to Shannon that now the majority of what I do is actually essentially outpatient anesthesia, where I have kids fall asleep so that they can stay still on the MRI scanner. And we have been advocating to get a child life specialist to work with us for years, because we know that there are probably a number of kids who could do it without us and do it without sedation if we just had somebody to help kind of coach them through it. And so we had been fighting for this, and we finally got a child life specialist. It was awesome. And so she came in, and I was like, I'm so excited to work with you. This is going to be awesome. And she goes out into the waiting room, and we don't have a children's hospital. We have like a hospital within a hospital, right? And so she goes out to the waiting room, and the waiting room looks like every other waiting room, right? And maybe there are a couple of toys thrown in the corner, and she's like, this is not how you care for children. And I was like, well, but yeah, this is what we've got. And she's like, no, you don't understand. If you want to take good care of children, we need this and this and this and this. Now, I had also been advocating for those things as well. I was just happy I'd gotten a child life specialist, right? I say me, I had not, like, this was not my decision. Somebody else with way higher pay grade decided about the child life specialist, right? But so, all of a sudden, I started not enjoying my time with this woman. And she's like, so when you are working with a child, you need to be thinking, oh, really? When I'm working with a child, I need to be thinking, right? All right, so remember when I told you before, like I've got 50% or 25% of my circle that's a pediatrician and another big wedge that's a mom. I've been doing nothing but taking care of children for over 20 years. So what is it that I need to know about working with children exactly? Graduate from Child Life School 2 months ago. I know you're all thinking, gosh, I wish I worked with her. All right, so parts of your identity can actually be threatened by interprofessional teamwork, right? Like I wanted nothing more than to have someone to work with until I did, right? And then I was like, oh, okay, so you know what? She actually does know what she's doing, and I want her here, so maybe I should accept that she's also got a big chunk of her pie that's child life specialist, and a big chunk of her pie that's mother. And maybe I need to find space, right? So I want you to take a minute and maybe just flip over either one of those sheets that I gave you. And I want you to think about these two questions just for a minute. What are 3 things that are unique and specific to your profession? And what are 3 things that you, in your profession, do that add value? So when you are writing down something unique or specific about your profession, who wrote something about specialized knowledge? Who wrote something about maybe knowing how to use equipment or do procedures that other people don't know how to do? What are some of the other things you came up with? I'm sorry, caring for an individual? Okay. What else? Yes? Guiding students and helping them make career decisions. What else? This should be the easy part. Yes. Prepare students to take care of patients. Yeah. I'm sorry? Using the nursing process to make decisions. All right, so things that I sometimes hear about are, I'm going to start with the bottom one, specialized knowledge. So in massage therapy, which somebody massage down here? There, okay. You know, you probably have a really good knowledge of the musculoskeletal system. You probably know a lot about where those things fit together and how to manipulate the muscles to cause them to relax, right? Like you probably know a whole lot more about that than I do. And thank you for knowing that. There are probably people in, where are the dental hygienists? So I was at the dentist the other day, and I was having my teeth cleaned, and then the dentist came over, and they were having these whole talks about certain numbers and lingual and buccal, and you know, like I knew what all of those words meant, but I had no idea what they were talking about in my mouth. Is that fair? Yeah, so specialized language, right? And so then there are procedures. My cath lab friend, I guarantee that there are procedures that you understand that I have no clue what they're about. Is that fair? Yeah. Oh, no, I guarantee it. And equipment and technology, right? And so these things are both benefits for teamwork and barriers to teamwork. And what I want to talk to you about here, so these are just a couple of commonly used abbreviations in healthcare settings, right? And you can see that some of them have dramatically different meanings depending on the context, right? And so, you know, when I'm sitting in the dentist chair and they're talking about some number, I assume they're talking about a tooth. I don't know which one, but as long as they do, I guess that's okay, right? Because they're communicating with one another. But the problem with that is that sometimes when we get out of our inner circle where everyone understands that language, we don't take the time to explain it. And I think that this happens pretty commonly. So we have inadequate translation. When I say DOA, I really mean the date of admission, right? Or when I say lingual, I mean it's the part of the side of the tooth that's near the tongue. Is that right? Oh, good. I was worried about that. Okay, right? And so we may all have context for the language as it's generally used, but we may not know what it means in the specific. And so to work in a team, we have to do that translation. There's also what I like to call, and again, I say I like, somebody else called it this first, but I, am taking it on as my own, the curse of knowledge. All right, so this is my son Silas when he had just gotten his driver's permit. And so I think about the fact that I had been driving for 30 years when I started teaching Silas to drive. So we went out and I took him to a parking lot and I said, all right, get behind the wheel. And he's like, really? And I'm like, yeah. So he gets behind the wheel and I say, okay, so what I want you to do is drive up to the end of this row, and there were no other cars in the parking lot. That was very purposeful. And I said, and I want you to get to the end and I want you to turn and then just go back down this row. And he's like, okay. So he drives up at like 5 miles an hour to the end of the row. And I'm like, all right, this is good. And I'm like, so turn. And he goes, and I'm like, no, you gotta turn. You really gotta turn the wheel, right? And he's like, well, you didn't tell me that, right? And he like starts getting all mad. And he's like, you wanted me to screw this up. And I'm like, yeah, I wanted you to drive my 30,000 car into a tree. That's exactly what I wanted, right? But the point was, I forgot that saying you turn the wheel when you're turning the car 90 degrees actually takes some effort to turn, right? Because I do that without even thinking about it. Silas was not an expert driver. He was a novice. I needed to give him that kind of information. And so when you are an expert in your area, you forget what it's like to not know. And you forget, and I think we're a little bit better at this when we're teaching students, because we can kind of remember, like, if not from our own learning, but from the learning of the class the year before, maybe, what they need. But we tend to underestimate what needs to be communicated. And so there are gaps in the information that you supply. Does that make sense? And so that leads to inadequate communication. But so the next 2 years later, when I was teaching my son Max how to drive, let me tell you, when he got to the end, I was like, all right, now really turn the wheel, right? But the person who might have been the best person to teach him would have been Silas, because he remembered, because it had only been 2 years since he had learned, right? And so there are gaps in communication or insufficient explanation. And then the other thing is something that's called coordination neglect. So when we get together in teams and we divide up, so some of you guys have probably worked in a team where you go, okay, I'm going to go take this part and you take this part and we'll bring them back together, right? We do a really good job of planning how we're all going to go apart and do our thing. We do a lot less well figuring out how we're going to put it all back together when we come back together. And I sometimes do an exercise where I have groups of people build a robot out of Lego. And one person does the arm, and one person does the leg, and one person does the torso. And they each do their part exquisitely well, but when you bring them back together, there's no way to connect them to each other, because no one thought about that component before they went off to do their part. And so that's called coordination neglect. But there's also this idea that the single biggest problem with communication is the illusion that it's taken place. And I have a great story I can tell those of you later about when my husband and I were trying to coordinate picking up our 3 children, and we all ended up in different places. Right? And so if you do that stuff about your kids, like, you can only imagine how often it must happen about stuff that's less important, right? So there's the possibility of just inadequate communication. And so one of the potential interprofessional pitfalls that comes along with this is when people have communication breakdowns or coordination neglect, that here again, instead of attributing them to the fact that I forgot what it's like to not know that, or I just assumed you knew my vocabulary, or I thought we had communicated that adequately, then we start, just like the fundamental attribution error, we start giving that agency. It was, well, Mom, you didn't tell me, you didn't want me to be able to drive, right? It's not that I just didn't know that I needed to tell him it that way, right? And so we assign malicious intent as opposed to recognizing it might just be a simple breakdown in communication. All right. And I also want to bring up that we talked about elephants and icebergs as it applied to people. We also have our professional elephants and icebergs, right? So we have perceptions. This is what it means to be a radiology technician. This is what it means to be a pharmacy tech. This is what it means to be a nurse. Right? And you can have very deeply held beliefs about those things that people can run up against. And you can also have ideas about how your profession fits in the team. And if that's different from how somebody else views your profession fitting in the team, then that's also a place that things can break down. I'm going to skip this one. All right. So why do we even have teams? Going back to the very beginning. Patient outcomes. What else? Time. What was that? Respect. Perspective. Oh, because different people bring different perspectives. Okay? I'm sorry? Holistic care. I can't do everything myself. Yes? To find some solutions. All right, it's getting close to lunchtime. I gotta spice it up or something here. All right, so one of the first things that I usually hear is getting things done, right? So there are some things that we can just not do by ourselves. If I need to move my couch, somebody's going to have to help me. That's just all there is to it. Sometimes it's because we need to address complex and changing situations. So, this woman might have one thing going on in the morning, and by later that afternoon, it may be completely different depending on her circumstance, right? Our student might be an A student at the beginning of the semester, and then something changes, and all of a sudden they're failing, right? And so things change, and we have to be able to keep up with them, and sometimes teams are very helpful with that. I also usually hear something about synergy, right? That when we're together, we can do more than each of us could do alone. And so this is the idea that maybe when the whole is greater than the sum of the parts. So I want to ask you what you see here. It's not a trick question. And you guys have all been teaching, and you know what it's like to stand up here and have no one talk back to you. A person holding up a picture to a crowd. Someone what? Taking a picture of the picture. Oh, this person over here. A speaker of some sort. Someone leading a group. All right, so that's an interesting word. So is this a group or is this a team? It's a group. So why do we say it's a group? They're spectators. Right. So if this person decided to leave, would it make any difference? Well, it might make a difference just long enough for this person to move out of the way, right? But if one person left, then it's really not going to impact the group, right? So this is a 1 + 1 + 1 equals, I don't know, 30 or whatever is there, right? So this, in this situation, the sum is probably equal, or the whole is equal to the sum of the parts. What about this? So if this first chair violinist gets up and leaves, is that going to make a difference? Yeah, that's going to make a big difference, right? Could the violist, I can't even say that, come over and take that spot? And, well, they probably have some idea. They could probably limp by, right? They could probably do something kind of like what they were doing, but is it going to be the same? No. Right? And so this is what's important to think about in healthcare teams, and I really actually love this analogy, because for this symphony to sound their best, they not only require an opportunity to come together and practice together and do their craft, but it also depends on the hard work and persistence of each of those individuals in their unique and special area of expertise. So this young man in the top right corner actually played cello at Harry and Meghan's wedding. So interesting things that you can learn when you're looking for pictures on the internet, right? But so, yes, you may be able to stand in for each other a little bit, but you're never going to be the same unless each of the groups is represented and you are relying on the expertise of each of them to really create the ideal sound, right? So do you see where this can be an analogy for a healthcare team? Do you see where this could be an analogy for an interprofessional education teaching team? And so in these situations, like the teams I've been a part of and this group, we have 1 + 1 and we equal the sum of those numbers. And we definitely have healthcare teams that are like that. Everyone's kind of doing their own thing and things get done, but it's nothing compared to this. Right? So the other thing that I want to mention to you is, as a reason to have teams, is relationships. So you remember back when I was talking about the negativity bias, and I talked about how over, generations and generations and generations, we had been acutely programmed to look for threat. One of the other things that we have been evolutionarily programmed is toward relationships. We have very strong instinctive desires to be part of a group. And if you think about this, it makes a lot of sense, because there were times when our very survival was related to our ability to function in a group. Because if you were a caveman and you were part of a group, you could bring down the mastodon and you could all eat. But if you were this guy, your chances weren't nearly as good, right? So we have these very instinctive desires to be part of a group. And this is something that is now known in positive psychology as something called hive psychology. It is about wanting to be part of a group. It is about wanting to be recognized as a contributor to that group. It is about knowing that other people, or bees in this case, recognize that you are there. And there are emotions that go along with this, like teamwork and like cooperation and interdependence. And it is the I will go the extra mile for you because I know that you will go the extra mile for me. And when I decided I was going to leave the pediatric ICU, it took me 3 years to do it, not because I wasn't sure that I wanted to leave, but because of the people that I knew were going to have to pick up the slack if there was one less person around. And I wasn't going to do that to them. So I imagine that you can think of your hives, right? Maybe it's your church family. Maybe it is your community here. Maybe it is your family of origin. But there are hives that you belong to that you know that you would do anything for them and they would do anything for you, and your life is enriched because of that. Yeah? All right. So that is wonderful, right? Like, that is a wonderful thing for each and every one of us to have. And we all have more than one hive, probably. But the thing about being part of a hive is that there are necessarily others who are not part of your hive, right? And it's very easy in healthcare education to have our silos, right? To have our us, our we. And we circle the wagons, right? This is our hive, this is our group. We want to be with them because our survival depends on it, but also because we love them and we want to be with them, right? But so anytime there's an us, there is also a them, right? So here's my third hockey reference, right? And so if you come after one of my people, you're coming after all of us, and vice versa, right? And so how do we move past the us and the them and get to the we, right? So here's a picture. I love this picture because, like, the doctors and the nurses are actually lined up across the table. They're like, you know, and we see it, you know, those of us who take care of patients, and those are the people who take care of the money about taking care of patients, right? There's always that tension. And then we can even see it in the classroom, right? So this is actually some people acting out Shakespeare. I don't think there are many sword fights in classrooms anymore. You guys are tired, or I have just lost you completely. It's really sad. All right, but you know, it can happen in education. I work in the nursing school building that is directly next door to the medical school building. How many times do we go in each other's buildings in a day? 0. Right? Unless we're very deliberate about it. And so how do we get to the we? And that's what we're talking about today. So I talked to you about the 3 things that are unique or specific to your profession. I guess we didn't talk about it that much, but it wasn't because I didn't try to get you to talk to me about it. No, I'm just teasing. And we talked about these are the things that I do that add value. So now I want you to add one other thing to that list. And the thing I want you to add are, what are 3 things that make you feel valued? Is anyone willing to share? Sean. Great. Anyone else? Please. Could you guys hear? I couldn't hear you very well, so I'm sorry. I'm going to run this up to you. Okay. So seeing students succeed in the things that you've taught them. What else? Please. Being invited or included. I'm sorry? Time? Having somebody share their time with you. Yeah. Yes. When someone seeks your advice. So I teach pharmacology to our graduate nursing students. And there was one day I was walking through the lobby of the school, and one of the students came up to me and said, you know what, I've been administering Lasix for, as many years as I've been a nurse. And after your class on diuretics, I finally understand how it works. That was 3 years ago. I am still writing that comment, right? Like, that was awesome. Yeah. When someone advocates for you, that's a great one. Anyone else have something different? Yeah. So when the student has the aha moment, so what I'm trying to bring you to now is a concept, and this is the area where I actually do research, the concept of mattering. So mattering was first defined as the feeling that we make a difference in the lives of others and are significant in the world around us. And I think if you think about what people volunteered, I think all of them get to that kind of feeling, right? Feeling that you matter is relational. Even if it's a sense of accomplishment, somebody has said something probably that lets you feel that way. There are opportunities where we just feel good on our own, but there probably is some feedback somewhere that contributes to you getting to that feeling. And so in the past couple of years, there have been a couple of people who have started doing research about mattering at work. And Jung was the first person, and she talks about interpersonal mattering. So those relationships and those connections with the other people. And she talks about societal mattering. And this is a place where I feel like we in healthcare and we in education actually are rich, right? Because I think that for the most part, people value us as teachers. They value us as healthcare professionals, and I value the guy that comes and gets my trash, but I don't think about him very much, right? We get thought about, and we get appreciated by society. Another group of folks have talked about mattering at work, and they've talked about it in the context of both recognition and accomplishment. So we achieve the things that we're after, and somebody notices. So what's really interesting is that in the research that I'm doing, people will tell me that they feel like they matter. They will give me very rich stories of interactions that they have with others that make them feel like they matter. But when they fill out the scale that goes along with this interpersonal and societal, it'll look like they matter. When you fill out the ones that's recognition and accomplishment, it doesn't correlate. And so for people in healthcare, it seems like this relational component is really, really key. And then the one that I like best comes from a guy named Isaac Perlatinsky, who works at the University of Miami. He is actually their vice provost in charge of, I'm not going to remember the exact title, but it's essentially mattering. It's about community and educational climate. And he talks about mattering in the context that you've heard me talk about it. You feel good because you add value, and you feel good because others make you feel valued. That's what makes you know you matter. Adding value and feeling valued. All right, so here's my one last little video for you guys. So the researcher who talks about this talks about it in terms of fairness, and it's his research, so he gets to talk about it however he wants. But I want you to think about it in the context of mattering, okay?
So a final experiment that I want to mention to you is our fairness study. And so this became a very famous study, and there's now many more, because after we did this about 10 years ago, it became very well known. And we did that originally with capuchin monkeys, and I'm going to show you the first experiment that we did. It has now been done with dogs, and with birds, and with chimpanzees. But with Sarah Brosnan, we started out with capuchin monkeys. So what we did is we put two capuchin monkeys side by side. Again, these animals, they live in a group. They know each other. We take them out of the group, put them in a test chamber. And there's a very simple task that they need to do. And if you give both of them cucumber for the task, the two monkeys side by side, they're perfectly willing to do this 25 times in a row. So cucumber, even though it's really only water in my opinion, but cucumber is perfectly fine for them. Now, if you give the partner grapes, the food preferences of my capuchin monkeys correspond exactly with the prices in the supermarket. And so if you give them grapes, it's a far better food, then you create inequity between them. So that's the experiment we did. Recently, we videotaped it with new monkeys who had never done the task, thinking that maybe they would have a stronger reaction, and that turned out to be right. The one on the left is the monkey who gets cucumber. The one on the right is the one who gets grapes. The one who gets cucumber, note that the first piece of cucumber is perfectly fine. The first piece she eats. Then she sees the other one getting grape, and you will see what happens. So she gives a rock to us, that's the task. And we give her a piece of cucumber, and she eats it. The other one needs to give a rock to us. And that's what she does. And she gets a grape. And she eats it. The other one sees that. She gives a rock to us now, gets again cucumber. She tests the rock now against the wall. She needs to give it to us. And she gets cucumber again. So this is basically the Wall Street protest that you see here.
All right, so I love that video. So if you think about it, monkey number one, and I'm personifying these monkeys, but monkey number one, perceives that he or she is adding value, right? She's doing the task, doing what's supposed to be done, and is not feeling valued, right? So how long do you think it is that that monkey is going to continue to be engaged? Right? So that was probably, they probably cut off the video there because after that, that monkey was like, yeah, no. Right? So we need to feel like we are adding value and people are recognizing that and valuing what we bring. And so when we talk about interprofessional education and collaborative practice, we have to think about the other members of our team as well as ourselves. How are we adding value? What makes us feel valued? How do we appreciate what the value that others are bringing? And how do we let them know? So if you look at the list that you just made about what makes you feel valued, think about when you have done that for someone else. Because there are people that I work with every day who I value and who I appreciate. And I don't go and I tell them every day, right? But when that student came up to me and told me that my lecture made a difference, and I remember that 3 years later, right? We can do that for each other. And if we are committed to creating an environment where the students that we teach go out and join teams where they feel like they are valued and they add value, we have to be demonstrating that to them as we work with them. So what value do our colleagues bring as we teach them? What value are we adding to help teach them? How do we walk away feeling like every member of the team is vital and important? Because when you feel like you matter, that capuchin monkey that's getting grapes, they're going to keep doing the work. They're going to keep showing up. But the opposite of mattering is disengagement. So if you're trying, we are all trying to create interprofessional collaborative education. That is the key. So to kind of finish up, and this is my last slide, I want you to be thinking about becoming a high-performing team of educators. Because that is how we will teach our students to be members of high-performing teams of providers. And the way that we do that is through an appreciation of who we are as individuals. So who are people bringing to the table? Recognizing that we have our biases and icebergs, but we also have incredible talents and knowledge and skills. And if we take the time to ask a question and assume positive intent, we can find those overlaps. We can find the connections between us at a personal level and at a professional level. And at a professional level, it's not just the overlaps that matter. It is the things that make us different that help us be a richer team. Because if you don't bring what's unique and special about you and your profession, then it's not going to be represented. So if you choose to bow out of an interprofessional opportunity, then please, get someone else who can represent your profession, because the rest of us need to know about it. And we need to hear what you bring, and we need to know how you add value, and we need to see that. And then when we come to teams, recognize that the relationships are really, really important. And taking the time not just to jump into the task, but to talk about how you're going to work together, to recognize what we're bringing, to think about how we're each going to contribute and bring our expertise so we get that synergy, right? So we're the symphony rather than the group. And then think about how you let the others in your team know that you value them and that they matter. Because that is the kind of work environment that we all want to have. As educators, as healthcare providers, and as the patients that our students are going to be taking care of. Right? So we have about 10 minutes left. I would love to have some discussion, but thank you so much for inviting me. Thank you for bringing me to a place where I could have grits for breakfast. Thank you for your attention. I know it's been a long time together this morning, and your contributions, and I would love to hear your thoughts. All right, Sean, I'll turn it back over.
For just a second while I have a captive audience about some things that we are working on. Oh, I'm sorry. Yeah, Tarina.
Every single time. Yes. So how do you start? So one way that you can start is by finding where there's a hole, right? Where maybe nobody has anything scheduled. Those are generally pretty hard to find. The other thing to do is to find a content area. So what we've been able to be successful in is saying, everyone cares about quality and safety, or everyone, or one of the things that we're doing right now, we're working with the athletic trainer students and the nurse practitioner students around concussion. And we're creating a case where we talk about what is, how do you manage concussion on the field? What does that look like when they then come to the office, go to the ER, when they come back to you, and return to play? With the recognition that we can never understand the full range of how to deal with a child with a concussion if we didn't have all of those people at the table. And making a commitment that because we think that this is important, we will shuffle our schedules so that we can find a time to put them together. And it takes that level of commitment to make it happen, because we're disrupting their schedule, we're disrupting our schedule. We found a place where we could put it in together that's not convenient for anybody, but we can all get there. And we said it's important enough for us to do. And that the only other way that I know of, and this takes a huge organizational commitment, there are some schools who have said Wednesday afternoon from now on is IPE day or IPE time. And so whatever classes you are doing during Wednesday afternoon should engage with someone outside of your immediate profession. go, right? But that's something that has to take place at the highest levels. And so it really comes down to find a time when nobody has anything scheduled and you can seize on it, making a commitment and being willing to disrupt other things in order to do it, or to get organizational buy-in in a way that prioritizes it. And that's really what it comes down to. Uh-huh. So there have been times that does happen, but just kind of making sure that if you say I can't make it on that day and that time, I would like to send someone else instead. The risk is losing the voice of that person in that profession. So bringing somebody else into that space who is interested and wants to be a part of it can be very useful, but the key is to make sure that the person that you engage wants to be there.
So I want to share with you guys some things that we're working on sort of on the backside. One of the things that we heard from you when we did our survey a long, long time ago, it feels like over a year ago, about barriers, the major thing, or one of the major things, was not knowing what other professions do, not having any idea of how we could engage another discipline if we don't know what that other discipline does. So we created a template, and nursing has finished theirs. It's going to be available on OneDrive, which right now you guys are like, what's that? But it's really easy to get to from your email. Nursing has already moved all of their shared drive stuff to there. I don't know if everyone has done that, but it's really easy to access. And this template gives an overview of what is happening in each course in each division. So nursing has a tab, and within that tab, there's the 6 nursing courses that we teach. It has in there what semester, whether it's fall, spring, summer. It has in there what the lab hours are, what the content is briefly. I mean, it's not this huge, dissertation. Janetta filled hers out. How long did it take you for your 2 courses? 5-10 minutes. So it's not a lot of work on our part in terms of creating it. I just will send it out sort of. I've sent it to the PNs, and I've not gotten that back yet. I will share with you that, and I told Julie this a little bit ago, it was really easy for me initially when I sent it out to go, they don't care about what I care about. Why don't they care? But I stopped, because that was my iceberg, right? Because I'm really passionate about this. And I said, okay, they're busy. And I know that. And it's not that they don't care and that they don't love me and that they don't love IPE. It's that this is a busy time of year, and that maybe I need to send it out at a different time. Or maybe I need to follow back up and make sure that they understand what it is I'm looking for. So rather than getting upset and being hateful, I stopped and we'll address it at a later time. And I get that, guys. Everybody's busy and everybody has an agenda. So I will send this out to each of you. I was going to send out the whole OneDrive and have you guys upload your own templates, and then I thought, no, that will never happen. So I will send out the template and have you guys fill it out and send it back to myself or John or Tammy, and we'll get it going. But this way you guys will have a quick reference. You'll be able to look and see, I'm teaching asthma this week, and this is how someone I could reach out to that teaches that same content. Or I'm teaching something on cancer. Who else teaches on cancer? You'll be able to have a quick reference, a control F, and you'll be able to figure out who teaches something oncology related at the same time as you, maybe even. So we're creating the opportunity for those overlaps. There's going to be other resources in these folders as well. Our crosswalks that we created that we sent out last year, I don't know if you remember those, that literally shows all the places that leadership says that we overlap. So if you're struggling to know where do I overlap with another discipline, it's all mapped out for you already. It's got to be intentional, though. Like Julie said, we've got to have the desire to do it and then commit to actually doing it. So we're still working on it, guys. anybody who has an interest in joining our little team Vector, it is growing, but please reach out to one of us and we'll let you know when we're meeting and we'll get things started. And if you don't feel like I can be a part of the team, but I want to do some interdisciplinary stuff, reach out to us for that too, because we have a template already in place for overlap opportunities, so to speak, so that you can see how your objectives and the other course objectives can overlap with one another for an IPE opportunity or event. So we don't have to reinvent the wheel. It's already been done. Any questions for me at all? Fantastic. I think they're putting lunch together. They are not putting lunch together outside. So I'll give you guys a chance to go use the restroom, and when you come back, hopefully lunch will be out there. I believe they're bringing some tacos and nachos and taco salad and all that yummy stuff. So make sure you eat, because there will be food for 60. So phone a friend, I guess. All right. Thank you guys so much for being here today.